Things to keep in mind is that a lot of times with our images for the lumbar spine, we try to keep things very simplistic and can backfire a little bit when it comes to things like test question preparation. So bear in mind that in the lumbar spine, we're not really dealing with the normal actual spinal cord because that terminates right around that L1, L2 area with the conus medullaris. And then we go into the cauda equina, which is really just a bunch of strands of nerves. And you can see that very clearly if we look at some MRI. So here is going to be a lumbar MRI, and in specific this is going to be at the L4 disc, and you'll see that we've got the little black things represented here, here, and here that are going to be our nerves, and then you have this big old lining of spinal fluid inside of the thecal sac. Now that compares to the cervical spine, where you have this very obvious area of darkness, which is going to be your spinal cord, where there's a lot of nerve component to it. And of course, there's going to be the surrounding spinal fluid here, but there's much more of this as compared to this lumbar image where you just see these smaller parts of it. So if I get back to your question, this is what they're usually referring to. So here we've got L4 and we've got L5. Here's going to be the disc. Now if we look at this side, you'll see that L4 does come out through that lateral foramina between those two. However, we have the L5 nerve root, which has come off of that conus medullaris and is running right in parallel with L4 until it gets just superior to the disc. But then it runs south of that disc and then past to exit through the lateral foramina between L5 and S1. If you have a herniation in this region, which is going to be more of a central herniation, likelihood is that you're going to have more of an L5 presentation. However, if you have a far lateral disc herniation, that would probably give you more of an L4 presentation when we look at radiculopathy. And this tends to be the case when we look at L3 and down. There's going to be kind of a flip-flop right around L3, L4, where you can have either of these two presentations. So I hope that clarifies what's going on. Let me know if you have any other questions. Bye.